Miranda, this is Sarah. We have a question.
Well, we have had to change some things, certainly, because of the concern about the COVID-19 infections.
Getting inside East Tennessee Children's Hospital looks a little different. Red and yellow signs greet anyone walking in. It's all to reduce foot traffic and keep patients safe.
Most things that are going around right now are not that. There's still flu and a lot of other respiratory viruses here. So these precautions are just to make sure that the patients we take care of, our staff, our parents that are here, are not exposed to anything that we don't want them exposed to.
Chief Medical Officer Dr. Joe Child says Children's Hospital is screening patients and their families. Screeners are asking questions about symptoms and recent travel. Child says Children's Hospital can test for COVID-19, but he says hospital staff has to see risk factors for it.
It is true in areas where COVID has been very present that not a lot of kids are testing positive for that. And that includes Seattle, that includes Nashville. So we do think some need to be tested, but most actually don't.
However, he says the testing process is still slow.
We're still looking at 3 to 5 days lag as it stands right now. We're hoping that that gets better so we can get more rapid results.
He says parents have to think of one key question if their child gets sick.
You would first look at them and say, would I normally go to the doctor for this? Does this look like just more kind of cold symptoms, stuff I can manage at home? They're not breathing hard, they're not running high fever. That's the kind of thing you would manage at home.
But if parents believe it's bad, go ahead and call the doctor.
If they're sicker appearing based on degree of fever or how they're breathing or how much they're coughing, then I think contact your primary care provider.
He says you do have to factor in COVID-19 into your decision, especially if you think your child may have encountered someone who has the virus.
Nobody is seeing severely ill pediatric patients, so that's good. The worry is that kids can get it and then give it to someone who's vulnerable, and that's where we're trying to balance the testing and how we're evaluating these kids.